The governor of Nebraska is declaring a hospital staffing emergency, and hospital beds are filling up across the state. 3 News Now reporter Jessica Edson tells us more on how bad it's gotten and the new directed health measure the governor has issued.
Today, Governor Ricketts announced that only 25% of all hospital beds in the state are available, 4% less than we saw during a peak of this pandemic in November. His data shows that COVID only makes up for about 11% of those hospitalizations, but staffed beds in Nebraska are dwindling regardless. Because of this, he has declared a hospital staffing emergency for the entire state. The emergency declaration makes it easier for retired and new healthcare workers to get to work to fill that need by deferring and suspending some of the usual requirements. Now, this emergency declaration goes through the end of the year, but the governor says if things don't improve, there could be even more measures put in place.
The staffing issue, am I open to further measures? Yes, absolutely. So this is a preliminary step to address the hospital staffing emergency we have right now, but we'll continue to watch what happens with regard to hospitalizations and may make further steps down the road.
Ricketts also announced a new directed health measure which will suspend elective surgeries for a month at hospitals throughout the state.
Some of the hospitals are already taking steps to be able to do that, but we're going to make it mandatory here in Nebraska to be able to help free up hospital capacity to take on some of the other patients that are coming into the hospital, both non-COVID and COVID patients.
Ricketts says they'll be keeping an eye on data when it comes to future health measures, specifically hospital occupancy. COVID data on a statewide level is only available to the public on a weekly basis, and hospital occupancy rates are not listed, just the number of hospitalizations. Reporting in Lincoln, Jessica Edson, 3 News Now.